So today I am going to perform the written demonstration of oral assessment. The purpose of this is to keep the lips and mucosa soft, clean, intact, and moist. So, good morning, sir. I am Arianne Curayag. I am going to perform the oral assessment in order to reduce your risk of developing tooth decay and gum disease. Is it okay to you, sir? So, assuming that I already performed a proper medical hand washing and other appropriate infection control, this is to avoid spreading organism. Assuming that I already closed the windows and door and curtains to provide client privacy. This is for the integrity and dignity of our patient. So, assess the client to a sitting position in bed if health permits. If not, assist the client to a side-lying position with the head turned. So, I will be assessing my patient to, this is the purpose of this is to make the patient comfortable in his position while brushing his teeth. So, sir. So, next is prepare the equipment. So I already prepared the equipment. These are the towel, basin, toothpaste, toothbrush, and clean gloves. And then the next one is place the towel under the client's chin to avoid mist while brushing his teeth. So I will be putting the towel on his chin. So I already put the towel under his chin. So now I will be putting the gloves on my hand to avoid spreading microorganisms. So I will be putting it. I'm done putting the clean gloves on my hands. So next one is to get the toothbrush of our patient. Moisten the bristle of client's toothbrush with treated water and apply the paste into the toothbrush. So I will be putting the toothpaste on our toothbrush. For the client who must remain in the bed, place or hold the curved basin under the client's chin, fitting the small curve around the chin or neck. So I will be getting the basin and put it on his chin. So I'm done doing it. So inspect the mouth and teeth if there's no infection or wounds. Some of the inspection. I see there's no any infection or wounds in his teeth, so I will be doing this. So I'll move the bristle up and down using a vibrating and jigging motion from sulcus of the crown of the teeth. And then repeat all over and an inner surface of the teeth and salty the gums are cleansed. And clean the biting surface by removing the brush butt and fork over them in short stroke. If the tongue are coated, brush gently with a toothbrush. So I will be brushing his tooth with gently. Brush gently. Hand I'm done. I will be asking the patient if he wants to brush his teeth with his own hand. Okay, brush. So hand the client the water cup or mouthwash to rinse the mouth vigorously. Then ask the client to spit the water and excess toothpaste into a basin. Okay, done. This is your water, sir. So, I'm asking the patient to spit the water and excess toothbrush toothpaste into the basin. Repeat the preceding step until the mouth is free of the fries and food particles. Okay. Remove the curved basin. Help the patient wipe his mouth. I will be removing the basin. And I will be wiping his mouth. So, assist the client to floss the teeth as each hand. Assist the client. And then to floss the upper teeth, use your thumb and index finger to stretch the floss. Move the floss up, down, and between the teeth from the tops of the crowns to the gum and along the gum line. As far as possible, make C with the floss around the tooth edge being flossed. Start at the back on the right side from the center to back of the jaw on either side. To floss the lower teeth, use your index card to stretch the floss and flow instruction as above. Assess the client. Give the client heated water or mouthwash to rinse the mouth and a curved basin in which to spit water. Since we don't have a mouthwash, I will be giving him water for him to spit. Okay, again. Okay. Assist the client in wiping the mouth. So I will be assessing the client to wipe his mouth. Again. Remove and clean the curved basin. Remove and discard the gloves. So I already removed the basin and cleaned the okay. Show me that I already cleaned the curved basin. Then I'll be removing the discard gloves. So this. So for our documentation, I will be observing his teeth. Okay. As I observe, the teeth, tongue, gums, and oral mucosa of the patient is all normal. There is no abnormalities, swelling, or infection. So we will be proceeding to our shampoo.